there's two pandemics. There's the pandemic of COVID-19, and then there's also the pandemic of the anxiety and the fear because of the virus. And we can't control the virus per se, but we can control our reaction to it. And the way we do that is by learning relaxation techniques. So for people who are hyper and can't sit still, exercise, yoga, any type of movement, dancing around your living room, listening to some Bob Marley, anything like that can be helpful. But anything to activate the parasympathetic nervous system. So I'm a huge fan of meditations, changed my life. You know, we tell people to use apps like Headspace,
yeah.
Insight Timer, Journey Meditation. There are all these apps that you can use that are having meditations. The Well actually has classes, meditation classes, yoga classes. There's so much going on. I mean, I think it's an interesting time because this is a really good time to actually start creating these new habits. Because the other thing I'm seeing with patients is people, I'm seeing New Yorkers who are pretty like go, 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 go. And their routine, they can't come to terms with slowing down because they're so used to getting up early, going to the gym, doing the, you know, I have so many of these women are these super women who, you know, have kids and husbands and jobs, and they're struggling with the slower lifestyle of this. It's a little bit different in Boulder, I'm sure. And I think the loss of their routine is a big thing. So what I'm encouraging people is to try create some healthy habits, you know, new routines, because you're going to be living like a variation of this for a long time. So try go to bed at the same time, try wake up at the same time, eat meals at the same time, get some structure and routine in your life, and start developing new habits like meditation. So it's an interesting time because we can use it positively. I know it's a difficult thing to do, but we can use it positively. I mean, as Bob will say, I mean, all the stuff that we're recommending now is stuff we've been recommending for the last 20, 30 years.
You know, the $1 million question here is, why are so many people asymptomatic or minimally symptomatic with the infection? Why aren't we studying that more? Why isn't that the number one thing we're studying? Is what's different about the immune systems of those people that, you know, maybe they lose their taste for a week, or they cough a little bit, they get a fever, and then they're fine.
Yeah, exactly.
What's different?
This is anecdotal, and I'm not being like Trump and saying this is the cure, because it's a tricky thing. I mean, everything's become so politicized. But what I will say, I have gotten so many emails from patients thanking me for getting them to go on a low carb diet, for eating well, for meditating, for dealing with their stress, for, you know, I use NAC, I use quercetin a lot, I use curcumin a lot, for putting them on these supplements, which I actually do believe help. I mean, I can't say for sure. I'm not going to get up there and say this is a cure, but I am, you know, I've got to say I'm pretty confident that, as Bob was saying, these patients who actually changed their lifestyles, are eating well, and are taking these supplements seem to be doing much better. So there's got to be something there. And as Bob says, why aren't we studying those people?
You know, when I was in my medical training, you know, they talk about, what do you do if you come upon someone who's unconscious, and they talk about the ABCs, airway, breathing, circulation. Well, I talk about the ABCDZ, right? Vitamin A, vitamin B, vitamin C, vitamin D, and zinc, you know, provide this foundation of nutrition that I think help everyone's immune system work better. You know, people ask me, well, if I get sick, should I start taking vitamin C then? I'm like, why would you wait until you're sick? Why not start the vitamin C now? There's pretty good data that vitamin C keeps your immune system in tip-top shape. Same thing with vitamin D. Same thing with just basic B vitamins. You don't need massive amounts, but just covering the bases for your B vitamins. All of those things are really critical. And just a little bit of zinc, you know, you don't need hundreds of milligrams of zinc. You need, 50, 60 milligrams.